This is Jen Anigina on eyesurgeontalks, and today I'm talking about macular edema. What is macular edema? Well, this is a term you may hear if you've had eye surgery, in particular cataract surgery, or sometimes if you have diabetes and you develop problems with your eyes, or if you have a problem with the blood supply in the eye, such as a vascular occlusion, a branch vein occlusion, or a central vein occlusion. All of these conditions can develop macular edema. And essentially what that is a bit of swelling in the retina, which is the wallpaper inside the eye. The retina is very thin, it's got lots of little layers in it, and it's got the cells which pick up the light and send the visual information across to the brain. And it's very, very sensitive to any changes, any perturbations. And when the retina suffers either from a lack of blood supply or some inflammation, it can react the same way as any other part of our body reacts. Our skin, for example, if we sort of get a cut or a bruise, you get some swelling locally, so you get collection of fluid from the blood supply, which brings about nutrients and everything to try to heal the injury. And in the retina, if that gets swollen, that's exactly the same thing we see on scans, such as the OCT scan. We'll see little bubbles of fluid inside the retina. This usually happens in the central part of the retina called the macula. Now, the problem is, if you get these little cysts, these little swellings and fluid collections in the center of the retina, the light that enters the eye can't pass through the retina quite so easily, and the retina doesn't work quite so well. And so the swelling in the retina can blur the vision. Now, macular edema occurs at a rate of about 5% after cataract surgery, so it's not that unusual. And typically you might find that you've had a cataract operation, the vision has gotten better, and then a month or two after surgery, suddenly you're finding that the vision's getting a bit more cloudy, and macular edema could be the culprit here. And the solution is to take some anti-inflammatory drops for a few weeks, which cures the problem in the vast majority of patients. With diabetes, you get a slightly different entity. It looks similar, where you also get little bubbles of fluid in the retina, and we call it diabetic macular edema to distinguish it from the post-surgical type. And here, this is due to the inherent blood supply problems in the retina because of the diabetic disease. And often this is a more grumbling, sort of low-level inflammation or swelling, which sometimes doesn't need treatment because if it's very mild, it doesn't tend to affect the vision. But if it does get more significant, if you get more fluid, then the longer it's present, the more it can affect things. So we don't want a large amount of diabetic macular edema to be present for a long time, because then you might notice that the vision begins to suffer. And for this condition, we will offer often nowadays anti-VEGF injections, so drugs such as Eylea or other ones on the market that will be delivered into the eye and have the effect of removing that fluid, of helping the retina to recover. And a similar problem develops with vein occlusions, so central or branch retinal vein occlusions, any sort of blood vessel blockages in the eye. Sometimes the eye recovers completely normally after developing one of these without complications, but it's not uncommon to develop some macular edema as well as other possible problems in the eye as a consequence of this blood vessel circulation issue. And in this case, you may also be offered injections into the eye to resolve the swelling in the retina. So it's a very treatable condition. We see quite a lot of it. And you need to establish a little bit what is causing it in order to treat it correctly.